Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our Tri-County Weekly Update. For Peoria, Tazewell, and Woodford counties, our current probable and confirmed positives now sits at 42,395. Again, that's 42,395. That's an increase of 1,400 cases in the past week alone. That includes an additional 857 in Peoria County to bring our total to 21,773. For Tazewell, an increase of 461, bringing their total to 16,131. And for Woodford County, there was an increase of 82 cases over the past week to bring their count to 4,491. Additionally, we had 18 deaths to report over the past week, bringing our to-date total to 635. Peoria County is reporting 2 deaths today, a male in his 60s and a female in her 70s, as well as a Woodford County resident, a female in her 80s. That brings Peoria to 309, Tazewell to 252, and Woodford to 74. Overall, 94% of our cases are considered recovered, and we saw a slight decline of 0.03% in hospitalizations. Compared to last week, our 7-day average now is at 200 cases each day for the Tri-County, which is a decrease from 269 the previous week, and our 14-day average is also lower at 235 versus 250 the previous week. Regarding our hospitalizations, we are currently sitting in our region at only 17% of ICU capacity available. Again, that's 17% of ICU capacity available. We currently have 46 ICU beds in use and 121 non-ICU beds in use. The hospital systems of OSF, St. Francis, UniPoint Health, Methodist, Proctor, and Pekin are reporting 1 additional death in the past 24 hours. We are still averaging 43 ICU beds in use each day in our Tri-County region, and we did see an increase in our med-surg beds from 106 to 130. I did want to take the opportunity to talk about vaccinations as well. The Tri-County is just at 30% fully vaccinated. You know, I've often come here and spoken about the importance of getting vaccinated for yourself, for your loved ones, your coworkers, and your community. But I also want to take time today to highlight that we really need to get vaccinated to move forward, and especially into phase 5. Regardless of the number of cases we're seeing and hospitalizations, all of which are linked to our ability to get people quickly vaccinated. Remember, for us to get to phase 5, we need 50% of our population to be fully vaccinated. That means that there's a lot more work to be done. We are nowhere close, and we're starting to see communities plateau. People are under this assumption that, well, at least those that are high risk are getting vaccinated, so now we can take a deep breath and be more relaxed, more complacent. And with that, we saw our cases increase, and now our hospitalizations increase, and our deaths starting to increase. But again, for us to get to a point where we can really reopen, I was recently on a call we asked a group what they would do when they reached phase 5. A lot of them talked about going to see a concert in person, going to a full capacity sports event, just gathering with family. If we really want to help our community, our businesses get back to normal and to the capacities that we want to enjoy, we have to all get vaccinated. And really, there is no excuse. There are appointments everywhere. The local health departments are running numerous clinics, both at standalone sites as well as community clinics that are just updating almost weekly throughout our Tri-County, as well as our hospitals and healthcare systems are also having appointments available. And let's not forget that our pharmacies and grocery stores all have access to vaccine. There really should not be an excuse. The hours start as early as 8 in the morning. We have weekend appointments. We go as late as 7 at night. So again, pay attention to our websites, our social media. We're posting any new vaccine clinics as soon as they come up. And I did want to highlight that today, Tazewell County started their drive-through Pfizer clinic. That's for individuals 16 and older. It runs, again, Thursday through Sunday from 8:30 to 5:30, and there is no requirements for appointments or registration. You can just show up. So again, that's going to be at the Tazewell County Health Department, and it is a Pfizer clinic, which really is targeting that 16 and 17-year-old population. All of this is important, and we're seeing the impacts of low vaccine rates as well as complacency in our hospitals. And to speak more about that, we have Dr. Douglas Casper, infectious disease specialist, University of Illinois College of Medicine, Peoria.
So thank you, Monica. My name is Dr. Douglas Casper. I'm the section head of infectious disease at the University of Illinois College of Medicine at Peoria. I'm here to give a clinical update on COVID-19 within the community. Over the last 3 weeks or so, we have seen a dramatic increase in daily case rate within central Illinois. Our daily positivity case rate is among the highest of areas within the United States. What has followed with that is an increase in hospitalization, both floor bed and ICU bed patient hospitalization, as Monica mentioned. We have set inpatient admission records over the last week for hospitals within our community. And what we are seeing is the patients are of a younger age than what we saw within the winter, and primarily are unvaccinated or have not yet completed their vaccine series. And so, as what Monica mentioned, there are many avenues for somebody to receive a vaccine within our community. At prior conferences that I've been present at, we were in different tiers where the vaccine was restricted by age or underlying condition. That is no longer the case. Vaccines are available through hospital systems, through commercial, and through many other ways that drive-through clinics and other, that people should strongly consider receiving vaccination and completing the vaccine series if they have not to date. On top of that, I would like to remind those that the vaccines do not work immediately. There's a period of weeks, typically 2 to 4 weeks after completing a vaccine series, for immunity to build and become protective to yourself and to prevent you from transmitting virus to others if you were exposed. Please remember that when you're choosing your activities in the coming weeks, as we are seeing COVID spread within the family unit as a dominant way in which people are becoming sick and later hospitalized within our community. So as we move into the summer months and the number of activities increase, which is wonderful, and we are all very hopeful to have many opportunities for a regular summer, please note that a lot of this is dependent on increasing vaccination rate within our community to as high a number as possible. Monica mentioned over 50%, but we're looking for all appropriate candidates to be vaccinated as short order as possible. So I can take any questions regarding clinical COVID changes within the community recently.
You said the patients that are showing up at the hospital are younger. Do you have a percentage that, you would say, well, 50% of them are under the age of 40?
Yeah, not so much a percentage, but the patient load that we were seeing in the prior surges was more within a nursing home or assisted living community in an age that tended to be 65 or older. The current demographics appears to be more in the 40 to 60-year-old. Okay. And while we are seeing those with chronic conditions such as respiratory conditions or other, we're seeing very many regular people as well, meaning people that do not regularly access medical care for chronic condition or are not taking a number of prescription medications that are becoming ill. And what this has to do with is that the dominant strain of COVID within our community has changed. So within the United States currently, the B.1.1.7 strain is the dominant strain, and this is a more transmissible form. Transmissible means that you are more likely to become infected if you are exposed, and especially if you are not vaccinated. And so with more exposures, more cases, there are just more people that are becoming ill, and what you see as an outcome of that is more people become hospitalized.
You said that most people are either not vaccinated or like half vaccinated. Do you have a percentage on that either?
I don't have a percentage, but what I would say is that we are not seeing a large number of breakthrough vaccine cases. And so where people have fully completed vaccination and passed the amount of time where they would be expected to have generated the immune response, we are not seeing a large number of breakthrough cases. When the vaccines were approved, they are not 100% effective, so you will see some breakthrough cases as a normal function of vaccination. But people that are receiving vaccine, it is highly effective, as previously discussed, in protecting those from being within our hospitalized group.
Even with that new strain?
And that is a wonderful point to point out, that the dominant strain is covered by the vaccines that we are currently discussing and are available.
There's been talk of patients using ER beds while ICU beds are unavailable, particularly in OSF hospitals. Could you talk a little bit about that, and maybe the pivot roles for it?
Yeah, so part of the function of a hospital system is to triage patients by acuity of care. We've gotten much better at caring for COVID patients, whether inpatient, outpatient, or at time of diagnosis. And so the hospital systems are looking to maximize their resources to help all patients that require care. But what that does require is triaging and stratifying patients. And as Monica mentioned, ICU bed availability is a finite resource. And so why we are talking about this is that all of the activities we go through on a daily basis to assure appropriate care require that we don't get an overwhelming number. And so when the hospital systems have to make decisions about transfer patient, going up or down a level of care, those are all within the mind of that there may be more people seeking care later that day or the next day. And so the overall way to solve this is just to have less people become ill with COVID-19, and that is achieved through widespread vaccination.
Would you say it's largely COVID patients that are contributing to this issue, or are there other people that with unscheduled surgeries, things like that?
Yeah, so regular life doesn't stop with COVID-19, and it's an important point that we want to be able to care for all patients. And so whether it's a traumatic accident or an unforeseen illness or a planned surgery, the hospital system provides many resources within our community, and having all of those at their optimal level requires having some flexibility within the system. And so we've gotten better at managing that, but we are at the level where it is being watched. We watch it on a daily basis, and we have to plan on how to get all of these events safely through.
From what you said, Monica, the percentage actually, the ICU capacity actually went up a little bit this week. It was at 18 last week, and it's at...
Sorry, it's at 17%.
Okay, so it has gone down a little bit. Capacity has gone down. Has it gotten to the point where we've had to move patients to other facilities, or are we still able to manage them in our hospitals?
So Peoria serves as a regional hub for medical care, and so we receive many requests, mostly to move patients into ICU beds within this community. Those requests go through a high-level coordination to assure as many requests come at the same time. So to answer your question, it is a daily pursuit, and that is not a typical stress on our system to manage it at that level. And so it is done, and it is being done very well, but it is something that would be of immense benefit to relieve that pressure, and that's why we continue to push forward for the request for the public to seek vaccination.
Do you have any sense why Peoria is one of the hot spots in the nation?
Yeah, I don't know. Michigan is a bigger example as a state level. It's many different explanations. It has to do with vaccination rate at that moment. It has to do with local practices about how people live in rural versus more urban communities. It has to do with availability of care and along different spectrum, but it's not an answer, a simple answer of that we have a different strain or that some factor is unique to this area. None of those have shown to be part of why. And so it's, the way I would answer it is the reason that Peoria is high is the same reason that Michigan is high and that other surrounding states are not seeing that number is that COVID has shown us that you can get intense surges in smaller areas. And what we've seen in the past is that this eventually leaks over into other communities. But the hope throughout all of this is that vaccination will hold against that. And so we're going to see if that suffices in then surrounding areas for protection. Okay, thank you.
So any questions?
The demand for vaccine decreasing, we talked about we were at that stage where there was very high demand, very low supply. Now there's supply everywhere, but are we seeing fewer people who actually want the vaccine now?
We are seeing demand slip, and I think there's lots of reasons contributing to seeing that demand. I think part of it is the individuals that are unvaccinated right now, so they haven't received a single dose, are individuals that might not trust the vaccine, might not have a history of getting vaccine or medical care, that kind of have an inflated understanding of their own health, maybe. So we see that group as part of it, but I think we're also talking about now a change in type of demand where, you know, before it was, again, people traveling across state lines to get vaccinated, and now it's more of convenience. So I see a clinic, it's open, maybe I'll go in, maybe I won't, or you'll see lots of now our community-based is going to be much more in different neighborhoods and continually moving so that any type of barrier, whether it's transportation, just kind of making sure it's visually there, making the vaccine the easy default setting, we can kind of create that environment. And in fact, to assist us with that, we do have a guard unit that has taken over the operations of our Headington Oaks site for us to start transitioning out of Headington Oaks and into the community more. So for example, they'll be doing both our first and second dose clinics out of the Headington Oaks site. That leaves our team able to now go to places such as I know we're going to be at the Frank Campbell Center next week, as well as the Light of World Church also next week. And so all those sites are available on our website. People can make an appointment. But we've had appointments day of that get filled. And so really for an individual, there shouldn't be an excuse as to accessing this vaccine.
So what are some of those areas either geographically or demographic-wise?
Vaccine data weekly just to see what those changes are. And right now, I would say this is still a little bit hard for us to see because, again, we've really opened up full vaccinations on April 5th. So, again, prior to that, there was a very prescribed process. But it's going to be very similar to where we see other issues around health. It's the 61603, 61605 zip codes. Some of our zip codes are already at 30 plus, close to 40% fully vaccinated. But we do have zip codes that are actually under 15%. And so you'll see a lot of where we locate our clinics are going to be in neighborhoods where we really want to make sure that we're working with the community agency. So for example, we're working with Public Housing Authority, the Peoria Housing Authority, to help us with that site so that, you know, that relationship, that trust, we can bridge it and help people understand the importance of getting vaccinated, and then again, making it really accessible for them in an atmosphere where they are used to.
So those zips where you're seeing 15% or right around there, is that predominantly within the city of Peoria or is that out in the rural areas?
It's predominantly the city of Peoria.
Monica, you said we were at 30% in the Tri-County fully vaccinated. How many, if you add to that, you know, people who have vaccinated, you would assume they're going to get the second dose. What percentage are we there?
I would say we're just shy of 40.
40%, so we're getting close to 50%.
We are. I think the question and the thing that makes us nervous, though, is that first dose number isn't growing.
Okay.
So we're still, again, people that we're vaccinating today are individuals that were eligible in March. And so what we'd like to see is that first dose number also growing really quickly, but that rate is what's actually slowing down.
How many first doses? Could you put a number on that? How many first doses are we doing on average right now?
That's really hard to say. I can say from the health department standpoint, we used to house Headington Oaks at a capacity of close to 1,800 first doses alone. We had a clinic this week where we had only 17.
With Tazewell County doing a drive-through clinic, are there plans to get one in Peoria too?
We're going to be mostly going to neighborhood sites. And I want to iterate, the Tazewell County drive-through clinic for Pfizer is open to all Tri-County residents, so Woodford, Tazewell, and Peoria. So again, I took that link and I shared it with all of our superintendents in our school districts, which are also OSF and Union Point are actually currently working with to actually get clinics on those sites as well. But again, I think it's going to be lots of various models to have vaccine clinics, whether it's a drive-through across the river or having ones that are really specific in neighborhoods.
Do you think the drive-through clinic is going to make things easier and thus get more younger people to want to get vaccinated?
I hope so. I hope the drive-through clinic people see as an easy option without an appointment, without having to do pre-registration, be able to be accessible to you, especially on weekends. I hope we see a huge uptake.
One thing people are nervous about with the rise in cases and hospitalizations is going back to mitigations, and it looks like there hasn't been a big update since about January on what we would do if that happened, if we broke those thresholds. Do you have any ideas on how that might change with vaccines rolling out?
Again, we're still waiting to see what the mitigations that might come from the state if we continue on this trajectory of increased cases throughout. Initially it was Region 1 and Region 2. Now we're seeing Region 7 and other ones also similarly come on track. And so we're hoping IDPH will give us guidance moving forward.
So we're still seeing nursing home COVID-19 deaths. So I guess my question is, because there was such a big push there at the beginning to get as many of those people vaccinated as possible, most of them are vaccinated. So how's that getting in and spreading? Is it people visiting? Is it staff? How's that happening?
So I think the nursing home deaths that we're starting to see, there's multiple factors. You really don't have a silver bullet on this one. Part of it is some of those individuals are vaccinated, but have breakthrough just because they themselves have, their immune systems are not ones that would necessarily respond effectively to COVID. Likewise, we have to also recognize that when we attribute a death to COVID, that means that the COVID infection could have happened, a time before then. They may have come through recovery. That's why we'll see sometimes we'll have little spurts of cases because through a case investigation that we've closed the case, they're no longer considered part of our active investigation, but that they've later died, they can still be attributed to COVID. So you'll see some of that also play into the number. So it's not necessarily that they were just actively symptomatic with COVID.
Early in the vaccinations, we were really careful not to waste any doses at all. And now that you have, more available, are doses being wasted because you don't have the right number of people come in every day, or?
Yes, we do have doses that get wasted. We try our best to not have that happen. In fact, just last evening, our staff was manning phone lines and calling restaurants all around campus town and asking them if they had anyone that could make it down to Headington Oaks to get a vaccine. Out of the, I think it was 7 extra doses that we had at the end of the day, we found 7 individuals to get it, but it's getting more and more difficult. The first dose saver list that we had active for a while, that's been cleared out. Everyone who's been on that list has received it. If we've added a name, we've added maybe 1 or 2 in the past week. So again, it's becoming more and more challenging, and so with that, our response has to change, and so we're very thankful that the Guard will be able to assist us with that transition.
Are there any other efforts in place right now to try and get that vaccine awareness out and get more people to get shots?
I think it's going to be a lot of what we're doing right now, educating the public, educating your peers. Individuals really trust information from groups that they have. So I would say if you've received your vaccine, share it. Talk to individuals about why you got vaccinated, what effects you had, even if it was a sore arm. But most people are trusting this information from their peers. We had a gentleman that told us that he was a little bit nervous about getting it because he had friends that told him not to get it and friends that told him to do. And he said, I listened to the friend that told me to get it because he was a smarter friend. And so, again, if you are, have gotten your vaccine, be an advocate. Tell your neighbors, tell your family members. We want more and more people to get the vaccine so that we can really reopen effectively. Okay. Well, with that, thank you, everyone.